I'm going to get Brad Cook up here from Hospital Clinica Biblia. This is going to be a good overview to the quality of private health care that you can get in Costa Rica.
Good afternoon. I'm feeling a lot of pressure with that introduction to really deliver today, especially for Dr. Murillo, who couldn't be with us. But I want to talk a little bit about why Costa Rica is a medical tourism destination, as well as the hospitals, and specifically Hospital Clinica Biblia. Through my company, Medical Tours Costa Rica, we've been running the international department for Hospital Clinica Biblia over the past 5 years. And we've had over 2,000 patients come from North America, as many as 700 Canadian patients as well. So we have a lot of experience managing international patients who have been coming to Costa Rica for healthcare for a variety of reasons that we're going to talk about in the presentation. So what incentives or benefits does Costa Rica offer North Americans? Why are patients coming to Costa Rica? First of all, it's our strategic location. If you take a look here at the map, we're only a few hours away from most of the key cities such as Miami, 2.5 hours, Houston, 3.5 hours, New York is about 5 hours, Los Angeles, I think, around 6. So we're actually closer sometimes for people traveling within, if they were to travel within the United States, coming to Costa Rica really isn't that far. So it makes a lot of sense as far as location. Here's kind of a map of Costa Rica as well, and some of the local flights that are available. So like I said, Costa Rica is located just a few hours from the United States. Our time zone is Central Standard Time, so we're not talking about a country maybe in India or Asia where the time zones are totally different. So it's easy to speak with us. We're on similar time zones. More than 20 direct flights to San Jose from the U.S. Also, the climate in Costa Rica is a great reason to come. You're seeing that during your visit. We do have our rainy season, which we're in the middle of right now, but it hasn't been too bad so far. Costa Rica also has a great temperature, 72 degrees average all year long, and even within San Jose, if you're on the north, if you're on the east or the west side, it can vary quite a bit. I live up on the mountains on the east side, which most of the people in real estate don't talk about, but it can get into the 50s, and it's even been in the high 40s sometimes. So at night, so it can be kind of nice as well for sleeping. So I'm going to talk a little bit about the quality care in Costa Rica. First of all, we're ranked 36th by the World Health Organization. That's actually ahead of the United States, and that's talking about Costa Rica as a health system. And one of the reasons for that is our socialized medicine and the fact that we provide very good care for the country, as well as having private medicine as well. So you can see us there. We're 36th. I believe the U.S. Was ranked 38th in the world. We also have the privilege of having 3 Joint Commission international hospitals that are accredited by Joint Commission. Joint Commission is the international branch of JCO, which accredits most U.S. hospitals. So there's a lot of similar standards. It guarantees different things, quality control procedures, raises the level of patient care. It encourages hospitals to demonstrate accountability. And this is really, not something that we take lightly. The Joint Commission comes in every few years. They do revisions. They're always adding in new things. I think it's part of their business to keep us having to get recertified. We had a lot of fun with one of our patient coordinators. Her name's Starlene, and she's always very, very nervous. And so we were told, a few days before the group coming from JCI that we had to be ready, and we were being trained on what to say if this happens and that, and what emergency numbers. So my brother Bill, who works with me, started calling her with another voice and just, saying, okay, this is JCI, we need to know about this and that, and she would get all nervous. But because we were drilled on the fact that we had to, this isn't something that's just in a textbook. You got to know exactly what to say. So, first of all, I'm going to talk about Hospital Clinica Biblia. I was actually born at Hospital Clinica Biblia in 1981. No, a little bit before that, but it was I guess you guys can't see me very well because no one said anything. It was the first accredited hospital by Joint Commission in Costa Rica. It was founded back in 1929. We have a brand new, now it's a few years back now, 3 or 4 years, but brand new hospital building with about 80 private rooms and 7 surgical theaters. We have over 300 physicians in our medical association, and that number is always growing. So really there's a doctor just about for every need, every specialty. And overall, it's the largest private hospital and the most modern hospital. There's also SEMA Hospital, SEMA San Jose. It's a group of hospitals. They have hospitals in Mexico, I think one in Brazil. They have a hospital here founded in the year 2000. It's also JCI accredited. They were the next hospital accredited. 60 private rooms, around 400 physicians, and they also have an international patient program. And then there's Hospital La Católica, founded in 1952. It also has a hotel in its premises. It was actually run by nuns, and it was part of their monastery, so it's a real neat type of hotel. And they do a lot of surgeries in cosmetic and weight loss surgeries and things of that nature. So it's really unique for San Jose to have 3 hospitals accredited by Joint Commission in such a small area. For example, in Colombia and in many other Latin American countries, that have very good health care, they don't have any JCI accredited hospitals, or they're just beginning to get accredited. So that's something that really positions us as a key location. And insurance companies and self-funded companies in the U.S. looking where to send their patients are looking at Costa Rica as a strategic location because of this. So experience treating North Americans. There were 36,000 medical tourists, that's the estimate, treated in Costa Rica in 2010. There are over 20,000 American retirees in Costa Rica, probably more than that. And there's an estimate of receiving up to 100,000 medical tourists in 5 years. So it's something that's growing. There's a lot of interest. We're being visited by all kinds of different organizations, insurance companies, government agencies looking at how to save healthcare costs by sending their patients to Costa Rica. And you can just see here as an example, between 1995 and 2006, the healthcare expenditure went up about 600%, and a lot more since then. So Costa Rica is invested heavily in the private sector in healthcare. Okay, and some other indicators about why Costa Rica is a good country for healthcare. Our life expectancy at birth is actually greater than that of the United States, and it's one of the top countries in the world for life expectancy. I'm going to talk a little bit about some of the other reasons. One of the other reasons for coming is obviously price savings. You can save a lot of money compared to what costs are in the U.S. For example, why does Costa Rica make sense for expats? Sam is a 54-year-old retail store owner living in Middle America. Over the past year, he has suffered severe pain due to a knee injury in his youth. His primary care practitioner recommends a total knee replacement procedure, which unfortunately is not covered by his insurance plan. The price he's quoted is close to $50,000. Through a friend, Tom hears that there may be more inexpensive options abroad, and an internet search brings up Hospital Clínica Bíblica in Costa Rica. After careful researching of the hospital and talking to doctors and former patients, Tom decides to fly for his procedure. His total expenses, including round-trip airfare and lodging, possibly a little bit of a vacation, is $13,350. So you can see that those savings are substantial. And even some providers in the U.S. maybe are getting special prices at hospitals, but still they're going to spend at least $25,000, $30,000. So by coming to a country like Costa Rica, you're still going to be saving $10,000, $15,000, even the worst case scenario. And there are insurance companies and groups looking at creating or actually creating and implementing right now policies where they incentivize their clients or members to come overseas for treatment or to go overseas by eliminating co-pays, deductibles, adding some tourism or not taking away from their vacation time and things like that, because it's saving the company money as well. So, in some cases there's up to a 75% savings and sometimes even more than that. And just to give you, a few examples of some price comparisons, you can see, for example, a knee replacement from, an average of maybe $35,000, $40,000 in the U.S., $11,000 in Costa Rica, and several other procedures, gastric bypass. Obviously, in the U.S. there's a problem with obesity, and we're getting a lot of patients coming to Costa Rica for surgery, for gastric bypass, lap band, things like that, as well as some procedures we're doing for patients with diabetes. So there's a lot of good reasons to come. Some of the benefits of medical care in Costa Rica. So first of all, reduces overall costs while maintaining quality of outcomes. We have great hospitals. The comments I hear from our patients over and over again is that the hospital was nicer than what they were accustomed to back home. The care was better. The doctor spent more time. Often a higher level of personalized care by nurses, doctors, and hospital staff. And this we hear all the time. I was at a conference, a medical tourism conference a few years back in the U.S., and someone from the American Medical Association was presenting in kind of their case why patients shouldn't travel overseas for medical care. And there are some good reasons if you're not going to top facilities. At the same time, he didn't seem to mind the fact that a lot of patients are coming to the U.S. for treatment from overseas. But he was saying that the problem is you don't have a relationship with your doctor when you're going for medical tourism. And there was a person that came up later, and when there was time to ask some questions, and he grabbed the microphone and he said, the only time I ever had a doctor-patient relationship was when I went overseas for medical tourism. I never had that back home. So that kind of shut him up. Costa Rica is also known for great dental care. That's one of the top things that we have here. Savings can be 60 to 80%. I mean, savings can be huge, on patients that need implants or, full mouth restorations and things of that nature. We can do that at Biblica. There's also other great dentists and clinics doing that. Highly qualified medical professionals. Our doctors have studied overseas. Costa Rica, just through our socialized medicine and hospitals, they get great training. Most have, done fellowships, done training, done specializations in the U.S. and Europe, things like that. So you're going to get great doctors, state-of-the-art medical technology. And so why Costa Rica? Probably the best way to sum it up is to look at it through the eyes of some of the patients and some of the testimonials we received. I actually have several others, but I narrowed it down to one because I added in a few other things. But just want to read one, and this is something we get all the time. I truly want to thank you for helping me get my life back. After several years of knee pain, total replacement was my only alternative. Once you and I made contact, I didn't have to do anything but show up. You made all of the arrangements and made me feel totally comfortable in a scary situation. Coming to Costa Rica, Clinica Biblica, and having Dr. Oeling as my surgeon was a wonderful experience that I won't soon forget. The hospital staff was so nice and made sure that I had everything I needed at all times. For me, it was a relatively easy surgery. After a few days, I was walking on my own, although slowly, and after a month, I was back doing activities I had not done in years. My only regret is that I did not get to see enough of your beautiful country. I'll be back. So that's one example of testimonials we get over and over and over again by our patients. We had a testimonial one time where the patient said, I felt like I was in a 5-star spa if it wasn't for the fact I'd had surgery. And that's just the fact that they're handheld through the entire process, they're cared for, they're picked up at the airport. So really everything is set up for them where they don't really have to think about anything. So what is medical tourism? I know some people, just hearing the word tourism with medical don't really, think the two should go together, and you can have different points of view. But for me, tourism is, if you're in another country and you eat at a restaurant, you go to a show, you go on a city tour. It doesn't mean that you're out, laying on a beach necessarily. So that's what we're talking about when we say medical tourism. And it's the process of traveling overseas with the purpose of obtaining medical care or health or wellness services. So what factors motivate U.S. patients and Canadians and North Americans and others to travel for medical care? First of all, if we're talking about the U.S., it's the high costs of services in the U.S., increasing number of people without adequate insurance coverage. Numbers vary from 30 million to 50 million, but the point is there's a lot of people that need surgeries, that need medical care and can't afford it. In other countries such as Canada, Great Britain, that have socialized medicine, and especially in Canada where they don't have the private health care option, it's also been an incentive for patients to travel. Like I mentioned, we've had about 700 come from Canada. Just in the last year or so, about 600. And, there were patients specifically looking for specific procedures that they just, weren't available to them in their home country. Expertise in certain procedures, that kind of goes along the lines of what I'm talking about. Non-availability of certain procedures back home. So, or also long waiting times, like I said earlier. We'd hear from Canadians saying, well, they want to do my knee replacement, but I'm going to have to wait 8 months, a year and a half. And just because of quality of life issues, I'd rather come and get it done now. What type of procedures are patients traveling for? Okay, they come for just about everything, but we have kind of two categories. There's elective procedures, patients coming for cosmetic surgery, dental treatments, medical checkups, ophthalmology, orthopedics, weight loss procedures that maybe aren't necessarily at that point life-threatening. Probably they're not going to be covered by insurance either, so we have patients coming for that. Costa Rica has gotten a reputation as being kind of the Beverly Hills of Central America, Latin America in the sense of plastic surgery. So there's quite a few doctors that do that here, but we offer a lot more. I mean, we have patients doing, cardiovascular procedures and, all kinds of more types of procedures that I want to mention here. Non-elective procedures, cardiology, spinal, gynecology, all kinds of general surgery. So just about anything that's non-emergency, meaning that, you can get on a plane and come down, we're doing here is, especially if it's a patient that we believe is going to have a good outcome and it makes sense to come. There was a patient that lives in Florida. He's from England. He was actually a pilot with the Royal Air Force, and he retired in Florida, and he comes down about once a year for different procedures. And, the last time he was here was probably about a year ago. What he told us one time, he said, if I were hit by a car, I would drag myself on a plane and come down to see you guys. So that's how much some of these patients believe in in the care that they're getting down here. The Deloitte Center for Health Solutions recently published a well-known study which indicated that in 2007, approximately 750,000 people traveled outside the U.S. for medical care. The study went on to predict that this number would rise to nearly 2 million in 2010. I'm not sure if we hit those numbers in 2010, but there definitely is a growing interest and more people going overseas for treatments. So what does the typical international patient experience look like? Just to give you a little bit of a snapshot of what we do and what it looks like, let's take a look at how a person might actually begin with the medical tourism process. And after this set of slides, we're going to, at the end, show you a video. It's an excerpt of about an hour and 15-minute documentary, but it's about a 5-minute excerpt where you can actually see, the patient through the video and him coming. But let's take a look at this person here. Sam is a 50-year-old retail store owner living in Canada. Over the past year, he has suffered severe pain due to a knee injury in his youth. After visiting his GP, he learns that he must wait 8 months for an MRI and potentially 2 years in order to have the knee replacement. Or in the case of somebody from the U.S., he just simply doesn't have insurance coverage for this procedure. We had a patient, the one in the video, he had a company where they laid tile in construction, and his knees were just shot, and he didn't have, he owned his own business, he didn't have coverage for it, and so he looked into having the procedure in the U.S. It was about $100,000. He looked into having it here. Everything, all told, was under $20,000, so he came down here. Through a friend, Tom hears about medical tourism. An internet search brings up a hospital in Central America, Clinica Biblica, and he realizes that the whole procedure, flights, and everything else, $13,350, as we talked about earlier. So, patient contacts hospital directly or through a medical tourism facilitator. Facilitators are kind of like travel agencies, but for medical tourism. Patient receives information about the hospital, doctor, and the procedure. Medical records are reviewed, and a price is provided for the procedure. There's a conference call with the overseas doctor, and that's really one of the key things for the patient to feel comfortable with the physician. Ask all the questions. We make sure we have a doctor that can speak English and is a good doctor. That we tried really to choose doctors that there's some great doctors, but they don't speak the language or they don't have time. So we tried to find, and we have a group of doctors that's willing to dedicate the extra time, willing to make those conference calls, emails, and really work with the patients. The surgery is scheduled. The patient receives detailed itinerary and information packages. We send all kinds of different sets of information so the patient feels comfortable about what their schedule is going to look like, who's going to pick them up, etc. Patient arrives at destination, is picked up at the airport, and transferred to a hotel or recovery retreat. Patient and companions might engage in tours. We recommend that if they're going to do that, to try to do them before the procedure. Well, now, look, I could tell you all kinds of stories about the tours patients have gone on after the procedure, but we had one gentleman, he was probably in his mid-70s, that came for plastic surgery, and he had his face all bandaged up, and a few days later he was on a public bus off to the coast. And then I gave a presentation about a week later at another seminar, and there he was in the front row with his face all bandaged up. And he was staying at a youth hostel as well with backpackers. So anyway, they come in all shapes and tastes, etc. But what we do find is that companions often will begin to get bored after a week or two, and they want to do something. So a lot of times, even if the patient can't, companions will want to do some tourism. Patient arrives at the hospital, this is Biblica, and is welcomed by international department staff. Bilingual patient assistant accompanies them to their appointments. Many of you maybe have met Marie-Lise from Biblica, who's here in the back with a nurse's uniform. So you might meet somebody like her at the hospital. All appointments and tests are fast-tracked, so patients have their pre-ops, see their doctor, and everything as quickly and efficiently as possible. Patient meets with surgeon after the pre-ops. The surgeon can look over everything, make sure that everything is set, that the patient's a good candidate, there's no surprises. I know none of you would do this, but we have had patients send us false information in the medical questionnaires because they want to make sure and have the procedure, and then they arrive and they have high blood pressure, or they're 300 pounds heavier than what they told us, or the pictures for the plastic surgeon weren't them. So we've seen it all. And so sometimes things have to be modified, or the price, or we've had to turn a few patients away. But generally we do our best to try to accommodate them. Patient undergoes the procedure. Patient recovers in hospital while in touch with family by internet. We assist them. Usually the patients will be accompanied by a family member, but if they're not, we go the extra mile to help them. Costa Rica also has great hotels and recovery centers for them to recover in that have that nursing assistance can be provided or is provided already at those facilities. Several days later, depending on their evolution, they'll meet again with the doctor at the hospital. Some cases, the doctor will even visit them at their hotel and just make sure that they're all set to go back home. They'll get instructions of what to do. And patient taken to airport, returns home. We always monitor patient. We keep in contact through email, calls, making sure everything's on track. If they have any problems, they contact us. We coordinate with doctor. So we have a pretty good system. We have a great country as far as healthcare, doctors, technology. But why Costa Rica? Strategic location, economic and political stability, quality of life. We were ranked by one study not too long ago as the happiest people in the world. I think you may have heard that already, or the best place to live, or somewhere along those lines. When I'm driving, I don't know how they came to that conclusion, but JCI accredited hospitals. It has to do with the health system, with political stability, no army, things like that. State-of-the-art medical technology, qualified medical professionals, top 10 sustainable destination. So we're going to end with a video. It's about 5-6 minutes. Just give me one sec here, and we'll go ahead with that. And if anybody has a question after that, then we can quickly answer them. Okay.
Following is a story of Bob, who in April of 2008 left his home in Orlando, Florida, to go to Costa Rica for a double knee replacement, even though he had health insurance in the U.S. The procedure would have cost $100,000 in Orlando. The hospital in Costa Rica charged $20,000, an $80,000 savings. Here is Bob's story.
The price Bob was quoted for his surgery was $100,000, and unaffordable to Bob even with the insurance plan Bob was covered under. Bob chose to go for surgery in Costa Rica because of the cost, but also because he researched and found out that Costa Rica was rated as having a healthcare system that performs better than the U.S. healthcare system by the World Health Organization.
I'm just picking up Mr. Robert Yantes from the airport 15 minutes ago, and going toward to the hospital Clínica Biblica to see his doctor.
I will have to say, when we got in the hospital, they were expecting us. They had all their ducks in a row. They were waiting to do what had to be done.
Okay. Can I see your ID, please?
Yes, you may.
Thank you.
Florida's driver's license.
Oh, okay, perfect. Okay, Mr. Robert.
Yes.
Thank you. Okay. Please, him to take your blood sample.
Okay. My actual blood work, I think, was probably 12 minutes from the time I walked in the hospital till the time it was finished. That was very good. Oh, good job.
Thank you.
We went into the X-ray room. The technology is phenomenal. He took the X-rays. I had to go take off my little gown and put my pants back on. which probably took a minute and a half, and as I came out of the room, he was processing the x-rays, already had them on the computer, they had been fed into the machine, and he actually was printing out the film. A doctor waiting for me. That's a new one. When I went to get my physical, the doctor was actually waiting for me.
Okay, I'll send my report to Dr. Oiling so he knows all your medical information.
Okay, I think in the segment tomorrow.
Yeah, yeah.
Very good. Okay.
Okay, have a nice stay here.
Thank you very much.
Welcome. Yes, beautiful place.
After a clean bill of health, Bob and his wife headed to the rainforest for some tourism and a canopy tour.
The best part of all this, I don't even think about tomorrow. I don't have time to worry about it.
This was the first time Bob had left the U.S., and he was extremely excited at the opportunities for tourism and experiencing another culture.
We're high.
This is fabulous. Yes? Oh, yes. Look at that.
Bob has had an amazing day at the rainforest, experiencing things he has never seen before. However, Bob's pain reminds him of why he came to Costa Rica. He realizes he will be in a wheelchair permanently if he does not take action soon. Bob is now headed to see Dr. Oding at Hospital Clinica Biblica before his surgery.
The problem, Robert, is that this space that you have here, about 4 to 5 millimeters, is the normal space. That space is not truly a space. That is filled up with cartilage, meniscus, and everything that we normally have on the knees. In the medial part, you have lost that. You are bone-to-bone contact here. The same problem, or even a little bit worse, on the left one. If everything is okay, in about 3 hours, everything will be done. New knees, new life. Okay. This is going to be an incision.
We have a special on knee replacements this week.
Fortunately for Robert, everything was fine, everything was okay. We could replace both knees without much problems. Usually on any surgeries, we try to do it one way, but doing the surgery, we may need to have some side steps, but in his case, everything was fine. We are in post-op number 2, second day after surgery. Things are doing just great. He has already walked 3 times, and almost without an important pain. He's still under medication, and I think that we are a little ahead of time. He is advancing very fast, and maybe he will be able to go to the recovery center in about a couple of days at most.
Okay. You want to go with the good one? We have daily crossed upon new thresholds of pain, always in my best interest, whether I wanted to or not. She knew her job very well. She put me through the paces that needed to be gone through in a short amount of time that we were here. She told me pretty much what to expect in the future, what I've got to do to get there, and I will be seeking more assistance when I get home. The rest is going to be on me, and it's my own fortitude that is going to have to prevail. I'm going to have to push all the way through and without stop if I want to get back to as good as I can be. This whole experience has quite honestly been the worst, best time I've ever had. It was a great experience, a hell of an adventure. I hope this brings us closer together as we should be, and that the rest of our life will move in a more positive direction. These change of life moments that we all have are important, and we have to take hold of those. When the seed is planted, water it and nurture it, and hope it all works out for the best.
Thank you very much. we're going to have a sign-up sheet for knee replacements if anybody is interested. I always find it kind of funny. The doctor says he's evolving without any important pain, and at the same time in the video he's cringing. And we got to know Bob pretty well. He was a big baby, so he was always complaining. But he's doing very well. And through the website on the Medical Tourism Association, they have a website, and under Angels Overseas you can see the entire video. It's about an hour and 15 minutes, and it's pretty interesting just seeing the whole process. But Medical Tourism Association, and they redid their website, but if you look around and look for Angels Overseas, you can find the website. So I don't know if we have time for questions, or we just...
Have done perfectly.
Okay.
Brad Cook, ladies and gentlemen.